Thank you. It's a pleasure to be here. So I work as a clinical mentor based in Omaheke region, but I'm also supporting the ARDAP region. So I am a clinician, although I also do a lot of public health, supporting facility capacity building and mentorship. So this small work, we did it at Epako Clinic, which is the main ART clinic in the Omaheke region. So as we all know, TB remains the first opportunity infection and the leading cause of death among people living with HIV. And Namibia, I think it was repeated this morning again, is among 30 countries with the high burden of TB and HIV and TB-HIV co-infection. In 2021, the TB was actually the third cause of mortality after COVID-19 and HIV. And in 2023, the country reported over 460 cases of TB per 100,000 population. However, this is actually the country. But when you zoom down to come to the regions, some regions like where I come from, the Omaheke region, you can see where I am. Although we have a very low rate of HIV based on the last population-based statistics, we had around 8 or 9% of people living with HIV. We still have a lot of patients coming with TB. Like in 2023, we reported 882 cases of TB, and we have a very small population, about 102,000, so which comes to about 857 cases per 100,000 population. This is almost twice the country incidence. But as a clinician, I've been observing a lot of patients, despite the test and treat strategies, patients still coming with advanced HIV and therefore with TB as well. But we don't really know which characteristic this patient coming with. That's why we conducted this small study to establish first the prevalence of advanced HIV among our newly diagnosed patients, and secondly, to zoom down to see the TB prevalence in the same group, especially under the test and treat era. Thirdly, we wanted to assess contributions of various diagnostic tools available in the country to the diagnostic of TB. So what was the method we did? It was just a cross-sectional study analyzing the programmatic data. So we recruited adults aged 15 years and above, enrolled in ART from January 2023 to December 2024. And we looked at their socio-demographic, the TB diagnostic and test tools utilized. We also looked at the HIV testing approach. Was it based at the facility, in the community? Was it voluntary counseling testing? Was it provider-initiated? Or was it ICT, index case testing approach? And also we looked at the patient baseline and HIV test, conducted baseline HIV testing. So we used the chi-square to establish our statistic values. We're using the Stata software version 18, and also multivariate logistic regression was used for where we found statistically significant variables in univariate analysis. So what was our result? First of all, when it comes to prevalence of advanced HIV, so despite the test and treat, which Namibia has been embarked on since 2016, we still encounter a high number of patients presenting with advanced HIV. So in our studies, we considered advanced HIV as patients presenting with CD4 below 200 or plus or with or without stage 3 or stage 4 condition. So as you can see in this slide, 46% of our patients are still presenting with advanced HIV in Omaheke region. So, but when we looked around those patients with advanced HIV disease, we would like to know how many actually presented with TB. We can see that almost half of them, 47%, presented with TB. And this is quite worrisome in our region. But our aim was actually to look overall patients who came and were diagnosed with TB, being newly diagnosed, or were they either together with others who were having advanced HIV. So therefore, when we zoom down to look at the prevalence of TB among newly diagnosed patients, regardless of being advanced HIV disease or not put together, so we found that 22% of our patients newly diagnosed with HIV presented with tuberculosis. So, and then we'd like to know who are these patients, where are they coming from, and maybe it can help us as a region, as a country, to know where we can put our interventions. So, then we found this. As you can see, probably all males, gender were the most affected in our setting. So, baseline CD4, most of them presented with CD4 below 200 despite the test and treat. And they all also presented with very low BMI, below 18.5, and the PITC, providing initiated testing and counseling, was the most approach in which we found this patient. And these are mostly offered in our settings, meaning in health facilities, especially at the hospital. This tells us that this patient, we only diagnose them while they are very sick and in the hospital. We are looking to get them earlier before they get to the advanced HIV stage. So when we conducted logistic regression, we only found that the BMI below 18 and a little bit of CD4 below 200 remained statistically significant associated with the presence of TB among newly diagnosed patients. But our aim was also to analyze contributions of various tools that we had at our disposition in this diagnostic of TB in our regions. Despite so many challenges and stock out of different testing tools, we combine all of them. As you can see, that majority of our patients were diagnosed with a combination of gene expert plus TB-LAM and also direct microscopy. We had very few patients diagnosed through only chest X-ray, and also we had patients from whom we missed their documentations. So, as conclusion, coming from Omaheke region, after testing treat in which the country has embarked since 2016, we still unfortunately report a high number of patients reporting or being diagnosed with advanced HIV in Namibia. 20% of them actually reported with HIV and TB co-infection. TB is likely associated with male gender, CD4 below 200, BMI below 18.5, and provider-initiated counseling testing HIV model. We also noted that the combination of gene expert and other various tools like the TB-LAM increase the likelihood of TB diagnosis in our setting. As a recommendation, we would like strengthening TB and HIV co-integration, as alluded to this morning by Dr. John, but also intensify early case finding despite the test and treat, especially among men. Unfortunately, they are still coming, and we lose some of them. We also have to leverage all the existing tools to put them together so that we can reach substantial number of patients with TB in our settings. Thank you very much. This is my small team from Epako. I also thank our co-authors, the Omaheke RMT, the Minister of Health and Social Service, CDC-supported program. Thank you.